This started. All right. Good afternoon, everyone. My name is Mary Andrews. I am the Associate Director for the Parent Information Center of Delaware. Today, we have Lauren Gillespie presenting around the transition plan. And she's going to give us some more information. Lauren will also be joining us at our Healthcare Transition Symposium in September at the Dover Library. I will drop these links in the chat for anyone who would like to register. During that symposium, we will be taking a deep dive into medical home and transition planning for your youth through healthcare. So at this time, I'm going to turn it over to Lauren. Thank you, Lauren, for joining us today.
Oh, my pleasure. I'm always happy to present for you all. Thanks for joining us. I have a little bit of interaction today. I have a little bit of talking, so hopefully this will be entertaining and informational. So today I'm going to talk about what we do in the Nemours Transition Plan Program. I'm going to talk a little bit about healthcare transition and what happens when your young adult turns 18 from a legal standpoint, and how to prepare for that a little bit. We get a lot of panicked phone calls, or I should say, I get a lot of panicked phone calls that my young adult is turning 18 and I don't know what to do. So, that's definitely a topic that I like to touch on. And then I'm going to talk about resources for how to support and help your young adult become a self advocate, a self manager of their own health, and that support is okay. And that's something that we like to normalize in our clinic as well. And then I'll take your questions if there are any. I'll probably ask to hold your questions for the end. You can put them in chat. I just can't see the chat. I know Mary's going to monitor it, but probably I did build in some time for questions at the end. So you can throw them in the chat. We'll get to them at the end. So a little bit about who I am. I'm Lauren. I'm a licensed clinical social worker. I'm also a medical social worker. I have an undergraduate degree from the University of Michigan. I lived in Michigan for quite a long time, although I am originally from Pennsylvania. Moved back to Pennsylvania after Michigan just got a little bit too chilly, um, and got my master's in social work from the University of Pennsylvania. From there, I had my first child, actually on the day of graduation from my master's program. And then I started looking for work and looking for some flexibility. I decided to start working in a hospital, which was Christiana Care, which many of you are probably familiar with, and started working with adults with special healthcare needs, and working just with adults in general. And so that was a really long time ago. That was, 20 plus years ago. And then 6 years ago, I started working in pediatrics. And I thought, well, what if I took my experience working on the adult side of things and started working with the pediatric population with young adults, and families who are transitioning out of pediatrics and heading toward adult care. And I could share some of my insights and my experience in the adult on the adult side of things. And maybe that would be a good combination. And it has been a good combination, I think. So that's the perspective that I'm coming from. So just a quick overview of the transition plan program, just for your information. So we do 90-minute, it's a long visit. Definitely have to pack a snack, maybe some water. We can take a break. 90-minute consultations for young adults starting their transition out of Nemours and into adulthood, because we are a pediatric facility. We do have age limits. Um, we we it's a little complicated how we work things. It's a little different than it used to be. But we usually start seeing people in clinic around 17, 17 and a half. And then I see people who are a little bit younger, for social work consultations, which are usually by phone. But I have talked to people as young as 10, to people's families who want to start talking about transition. But usually people want to start talking about transition around 14, 15, 16, 17. Those are usually the people I'm talking to for social work consults. So we usually talk to people yearly, more if needed, support anytime it's needed. For the clinic visits, Dr. Amy Renwick and I see patients around 17 and over in clinic for the 90-minute visits. It's very comprehensive. And I structured today to sort of mimic a clinic visit in terms of what the content is. So you can kind of see, like, okay, what kind of stuff are they talking about? And then the social work consults again are with me. So if you watch this or you're here and you're like, oh, I'm interested in that, just contact me and I'll get you in the right bucket of whether it would be a visit with Dr. Renwick and myself, or whether it would just be a phone call social work consult. So, what is healthcare transition? So, these are a lot of words. This is from Got Transition, which is a really good resource that you can look up and learn more about healthcare transition. I get a lot of resources from here just because they have like a lot of nice one pagers. And sorry, you're seeing some of my chats. They have a lot of nice one pagers that can be helpful just for explaining healthcare transition. So, healthcare transition, and I have to move my screen here. Okay. Healthcare transition is the process of moving from a child family centered model of healthcare to an adult patient centered model of healthcare. And sometimes it involves transferring to a new clinician, and sometimes it doesn't. So, like if you have a family doctor, you might not switch practices at all. But sometimes, if you have a pediatrician, you might be moving to a whole new doctor or a whole new facility. So, it involves planning, transfer, integration into adult centered healthcare. The goals of healthcare transition are improving the ability of youth and young adults with and without special healthcare needs to manage their own healthcare and effectively use healthcare services, and to ensure an organized process in pediatric and adult healthcare practices to facilitate transition preparation, transfer of care, integration. And that's straight from Got Transition, which is their whole thing is like facilitating healthcare transition. Okay, so that's a lot of words, but I want to take a minute and kind of get in the right headspace. So, everyone, so I want you to close your eyes if you want to. And I want you just to take a breath in through your nose and out through your mouth. So, and I want your breath out through your mouth to be longer than the one in. So, in through your nose, out through your mouth. A very calming breath. Very nice. So, one more time, in through your nose, out through your mouth. I want you to think back to your own transition to adulthood. And for some of us, that's a while ago. I mean, I'm 51. That's a while ago. So think back to some of the feelings and the emotions. Maybe as parents, we're also having some worries, feelings of uncertainty, fear regarding our young adults. It's so normal and expected. Just to normalize that, people come into our transition visits very, very concerned, very stressed, very tearful oftentimes. That's very normal. Change is hard. You know, a lot of people have been with Nemours or their pediatric team their whole life. Young adults are stressed, parents are stressed. These feelings of loss are real around leaving the pediatric team and going into the unknown. Maybe you've heard things that, you know, the adult world is colder. Maybe you've experienced that yourself. So these feelings are all very valid. And I think it's just really important to take a minute and sit with those, because pushing them down, they're just going to come out in a different way. So I just wanted to take a minute and think about and just pause and reflect there. And I'm just wondering if anyone would like to share anything about their own transition to adult healthcare, or how it felt, how it went, and just take a minute to really think back to that time. And if anybody wants to type in the chat or unmute, I'd invite you to do that at this time.
I can share a little bit since I'm one of the only people on here. I was a student with disabilities. I didn't have a lot of complex medical needs, but there were little bits and pieces. And as I navigated through that, I didn't really have support. I was from Sussex County, and there were not a lot of resources when it came um, to support, outside support. So we kind of had to navigate that on our own. Fast forward, my little brother, who has some more complex medical needs, helping him transition was a little challenging, even though I'm in the transition space, especially on the educational side. Um, it uh, it was a bit overwhelming, trying to one get him to get engaged in this process, and two, finding the people who can help him, through navigate through this. Um, so, when I started listening to your presentations, and working more closely with that is when I really learned about all of these steps needed to prepare, and the time that it takes, not starting at the very last minute. Um, so my feedback is to start as soon as possible. And not wait till the last minute, because he's 21 and we are still transitioning um some of those things. Just because if you need certain specialists or services, they may not be easily accessible when you transition from pediatric to adults.
That's such great advice. Thank you so much for sharing that, Mary.
No
And I think
problem.
the overwhelm is just such a common thread, and
Mhm.
the overwhelm will paralyze people and keep people from doing things ahead of time and just not knowing even where to start sometimes. So that's those are great insights. Thank you so much.
No problem.
So that segues perfectly into my next point. Who is going to steer this ship into adulthood? Selecting your young adult medical team. Sometimes when people come to clinic, they're like, whoa, I don't want to transition out yet. It's not, my young adult isn't even close to 21. Don't make us leave yet. And we're like, no, you don't have to leave yet, but it is better to start thinking about this stuff early, just like Mary says. Because there are long wait times oftentimes. And the worst thing that can happen is getting stuck as somebody who might be medically complex without a team. So we want people to start thinking early about who might your young adults medical team be. And that includes primary care, specialists, dental, eye care, and more, depending on the individual. So that's the type of thing that we start thinking about in clinic. We start going through who are your specialists now and who are they going to be on the adult side of things, because it might not be the same people. So this is one of the things we go over. In Delaware, we're so lucky because we have the Center for Special Healthcare Needs. And this is one of the places that I worked before coming to Nemours. And actually, in the very early days of the Center for Special Healthcare Needs, before it was called the Center for Special Healthcare Needs, I was the social worker there. So I know firsthand that this was a very needed service and continues to be a very needed service in Delaware, and it has sort of spawned into some other places. So, primary care for adults 18 and older with any type of special health care need, including complex social situations. The docs are family med and med peds, which means they're trained in pediatrics and internal medicine. They have longer appointment times. They have social work and case management supports. You can see their website for a complete list of populations that they serve. Welcome. Hello. But they are a wonderful, they are a wonderful practice. But again, they sometimes have a long wait. So I would urge anyone who's interested in the center to definitely get connected well before 21. They start seeing patients at 18. So um, that is a great local resource. Now, if you happen to live in Pennsylvania, or if you live in New Jersey, or you know people who live in those states, there are similar practices that you can look into, and I have them here, that you so that you can get connected. And really, it might not be super geographically convenient if you live in these states, but people do travel from far and wide because they are such specialized primary care practices. So I just wanted to include these because we live in an area where people sometimes, live here and then move to Pennsylvania or have family members who live in Pennsylvania. So I like to include the other states, even though we are talking about Delaware primarily. So, how does adult care differ from pediatric? Sometimes people don't realize that there are some big differences, and I did include a one pager here that does spell out some of the differences that you can look up on your own. From I think this is from Got Transition. Yeah, it is Got Transition. So, in pediatrics, your parents tend to be with you in a visit. In adult care, you see the doctor alone unless you do need that accommodation to have your parent or supporters with you. And typically, that is something you would have to request or at least consent to, or say it's okay with me. And we do encourage people, like, if you want your family with you in an appointment, you can say, I would like my family to be with me or my mom to be with me. And honestly, sometimes it's nice to have an extra pair of ears to listen or someone to take notes. So don't feel like you can't do that. A lot of times people feel like, oh, in the adult world, I can't do that. Now, COVID did present some challenges with that, and that's a whole other ball of wax, but hopefully we're past that. In pediatrics, your parents automatically just make your appointments, get your meds. In the adult world, you do those things. But it's okay to take some time to get there, or maybe you're always going to need some level of support. And that's okay. You just have to be able to say, it's okay with me, it's okay with me if my supporter um, gets that, it has access to that information. This is one that sometimes people don't realize. Sometimes pediatric doctors don't realize this either. So, this is something that's important for you to know as a self advocate. Adult Medicaid doesn't pay typically for out of state providers, with some exceptions. So, the general rule is you have to stay in your state for care if they provide that care in your state. In pediatrics, that's not so much of an issue. So, like, if you want to go to, let's say you live in Delaware and you want to use CHOP, for example, that's usually fine. That's not usually an issue. But let's say you're an adult who lives in Delaware and you want to go to Penn Neurology. Well, adult Medicaid will say, well, why can't you use Christiana Care Neurology? What's the issue here? And they will typically not pay for Penn Neurology if it's available in your state. So you might have a great plan for transition. Oh, I have a neurologist at Penn. I love this person. This is going to be great. And then you might be like, oh my gosh, my Medicaid is not going to pay. I need to make a new plan. And then I've got a 6-month wait for neurology in Delaware. So you can see how these things can get tricky. So that's one of the things that we help people work through when they come to transition. We might say, oh, do you already have a plan for adult neurology, if that's one of your specialists? And people might say, oh yeah, I'm going to go to Penn. And then we might say, oh, what's your insurance? And it's, Highmark Health Options. And then we'll say, okay, well, this is actually how it works. You might want to think about connecting with Christiana or neurology in Delaware. So that is one of the things that comes up a lot. Another, can I admit, Midra, or did you do it? Okay. Another big thing we talk about in our clinic is we talk about independence and starting to take ownership of health, because Mary and I were talking before the Zoom started about how busy we are as moms. We are so busy. We are doing a million things, and I know we're all in the same boat. Sometimes we forget that it's important to loop our young adults in to what we're doing. So we have to, all of our young adults, no matter what their status is, we have to kind of loop them in. Like, we need to loop them into their health. So one of our big focuses in our clinic is to remind our parents that a goal for any young adult is to take as much ownership of their health as they're able to. So we coach parents and young adults. So like who's making the doctor's appointments? Is if your young adult isn't able to do that for whatever reason, are they watching you do it? Are they sort of observing to see like, oh, how does mom do that? Does it magically happen? No, mom's making the effort to do it by phone or do it by app. Do people know what their meds are? Do they know what their medical issues are? Well, it's, a good thing to know that about oneself because, eventually mom's going to phase out or, mom's going to take more of a backseat role. And this is how people learn these things is by observing and then sort of taking on as much as they can. So it's sort of like an introduction to if you've been doing everything for your young adult forever, starting to step back a little bit and letting them take more of a role. We talk about who refills the meds. Can you loop your young adult into that process? Can you say, because a lot of times young adults are hearing this for the first time and they're like, "Ooh, I don't want to do that," because it's not exactly like glamorous. Like nobody really wants to be doing this stuff, but yet it has to be done. And then we talk about carrying your stuff. So sometimes I'll ask a young adult, like, "Oh, do you have an ID, like either a driver's license or a state ID?" And then they'll say, "Oh, yeah." And then they'll look at their mom and she's like, "Oh, yeah, I carry it for them." So we talk about like, well, how could you maybe carry your stuff? Like, are there any options like to start working on carrying your own stuff? And then they'll usually say like, oh, I'll just lose it. Well, could you start maybe carrying a copy? Like just starting to work toward that kind of thing. So these are some of the conversations we have in clinic. So this is some of our tips that we have about taking over one's own health management or just starting to. We're not expecting people to just like all of a sudden be independent. We're talking about small steps. So first we suggest watching your parent or caregiver do it because observing is a big way to learn. And then maybe doing it together, whether it's speakerphone or whatever assistive tech you might need. And then maybe you take the lead as the young adult and the parent is still there for support. The parent's still waiting in the wings to fill in any gaps. And then gradually you take over. The parent phases out if possible. Again, you might get pushback. Young adults aren't really chomping at the bit for this usually. Sometimes they are. Sometimes you'll get somebody who's like, "Yeah, I can totally do this." And then the parents like, "Okay." But usually the young adult's like, "No, this does not sound that fun." So you have to push a little bit. But then they're proud of themselves when they do it, honestly. And then a part of the visit is usually around medications because most of our patients that we see do take at least some medications. And we really do encourage that young adults learn their medication names. And one of the ways is really repetition. So if somebody fills a pill box, which a lot of our young adults do fill a pill box, and if they don't, it is something that could be an independence builder. Um, so if you are filling your pill box, you could loop your young adult in to say the name and dose as you fill the pill box. And through that repetition, a lot of people can really learn what their medications are and what the dose is, which is really valuable. And then sometimes pairing your medication with another routine, like if you always, brush your teeth or if you always, charge your cell phone, so we try to brainstorm like how can you remember to take your meds? Because a lot of times that is a huge thing that young adults are trying to figure out. And then of course reminders on phones. We always talk about assistive technology and how people can leverage that, even if it's like their cell. We talk about appointment, medication reminders, pharmacy apps, the portal. We sometimes people like more of a no nag, like low tech system, like a calendar where maybe they make a check mark if they take the med, or maybe they'll send you like a little emoji after they take the med. Like we try to make like lesson like battles like that people can get into because sometimes there's a lot of tension between young adults and their parents when they come into clinic around medication and like young adults push back. That's part of like what they do. So we don't want to like increase battling. And here's just some more ideas that I included. Oops. And then if you've got someone who's going away to college, just to be really mindful because, we talk to a lot of families and we do hear some horror stories. If you do live in a dorm or an apartment, you've got sometimes people coming in and out who like various meds for various reasons. So we do suggest getting like a safe or a lockbox or something to keep your meds in so that they can be accessible but also safe. Just a cautionary tale. Sometimes we hear things and we're like, whoa. So just transitioning a bit into more of my role in the visit. So Dr. Renwick talks a lot about that medical type stuff and that self-advocacy with the medications. A lot of families come in and when I start my social work type of stuff conversation part of the visit, a lot of families are confused about waivers. And one thing I like to talk about is like people are like sometimes are like, I know I should know this, but what the heck is a waiver? And really, you shouldn't know it necessarily because it's confusing and there's a lot of misconceptions. So, a lot of times I like to clarify and sort of talk about, like, okay, we're in Delaware, or maybe it's a Pennsylvania patient, because we do get patients from Pennsylvania, New Jersey, all the states. We get patients from Nevada. We get patients from all kinds of states because people come to Nemours for, our world-class doctors for various things. But we're here in Delaware. We're, at Pick. We're going to talk about Delaware. So, the way I like to simply put it is just a waiver is Medicaid waiving their usual rules. You're not waiving things, Medicaid's waiving things. Their usual rules so that people can receive care and supports at home or in their communities instead of in an institutional setting. So that kind of, I think, helps clear things up a little bit. And then we can talk about like, okay, which waivers are typical for people with special healthcare needs in Delaware, which are, I have a chart which I include here, which are, lifespan or LTSS. And then that kind of like clears things up a little bit. And then I usually just give some examples. Like if you have regular Medicaid, it's not usually going to pay for like home modifications, but if you qualify for a Medicaid waiver, it might pay for that. And of course, everyone's got their own individual situation, so I don't want to promise that everyone's going to get everything. But, if you might qualify for a waiver, you definitely want to look into it because it will provide supports for adults with disabilities that might be very important and might be the difference between you being more independent and being able to do things that you really want to do. So this is the link to the sort of comparison between the lifespan waiver and LTSS, which is the DSHP plus. Um, and important to know that you can switch if you need to. So people get really like, ooh, I got to make this really impactful decision, which is important, but also that, if you have to, you can switch too. So it's not, forever decision. And then the other thing that keeps people up at night is turning 18 because it is such a big deal. And if you come to our, what are we calling it? A conference in September, we're going to have representatives from Disability Rights Delaware talking more in detail about some things you can do when your young adult's going to turn 18 to help them be more empowered and help you feel empowered. But this is a one pager from Got Transition talking about turning 18. And a lot of times I'll ask young adults, like, oh my gosh, you're going to turn 18. Like, what do you think that means? And they'll be like, I don't know. Or they'll say, well, it means I'm an adult and I can do whatever I want to do. And then the parents are cringing. So it's kind of a loaded question when I ask that because I kind of want to see what they think. But the main thing in a health context is your health information becomes completely private, which is a big deal to parents because parents have been doing things all this time to help with healthcare and they want to continue typically with our population. And a lot of times, young adults do still want that help. So, how do you get that help? What can you do if your young adult still wants that help? I mean, there's so many different scenarios, and everybody's situation is unique. So, when we meet with families, we really delve into your own situation and what you need to do, and what you feel like you want to do, and what your personal situation might be. So, just in general, this is sort of some things to consider. So, some people might want to, do HIPAA forms so that their parent maybe will be able to still have access to their health information. And for some people, that might work great. And that's sort of like a small thing you can do. Some people might need more help. So a lot of times I'll say, just to introduce it, that decision making is a bit like a toolbox. And that's something I think we can all relate to. So when people are talking about like decision making options, I'll usually say, well, if you're looking at a toolbox, guardianship is like the saw. It's like the biggest tool in the box. But there might be other tools that might work just as well. And when we're talking about guardianship, it's the most restrictive option. And even the National Guardianship Association says that alternatives to guardianship should always be considered and identified whenever possible, including supported decision making. So then people say, okay, great. So what are these smaller tools? And here's a little sampling. And those can include supported decision making, which is a legal option in Delaware, and healthcare power of attorney, durable power of attorney, representative payee for SSI and SSDI. Special needs trusts can be considered an alternative to guardianship. HIPAA releases, like I said, and surrogate decision making. So these are all things that we can delve into more in a visit. And that if you meet with Classy, also known as Disability Rights Delaware, they can also go over with you as well. So I wanted to play a quick video about how this family and how this young man uses supported decision making to make it a little more concrete. So I'm going to play it, and I really hope you can hear it because I tried it with Mary and she could hear it. So let's do it. Let's see if we can hear it. Can you?
Supported decision making is that you are making decisions, but you also are actually getting help from other people.
One of the most important things about being human is feeling that you have control over your life and that you understand and feel good about what decisions you're making.
Decisions I would make on my own would be deciding what I want to eat and also check my mail when I need to, check in with friends, my parents, and my siblings.
We all use supported decision making. Every time you ask for advice from a friend, family member, you may ask advice from a professional when you're making a medical decision.
Some decisions I need help with. Who do I ask that help me make decisions on my own? Would be my peers, my parents, and friends in the community. I look for people that I trust and care about me. Some decisions I like to get help with would be definitely medical decisions. Sometimes you may not know what they are, and that there's always good people that can help. My mom helps me make decisions on talking to my doctor. She helps explain what's going on. Making decisions to live on my own is important. I prepare for myself for work. I have my clothes that I can lay out on my bed, and I make that decision on my own to do that. I might make mistakes, but I learn to pick myself up and keep going. My mistake would be drinking too much caffeine. I had to learn to cut back. I'm learning how to cook. I get to find my own recipes. I find my own meals, or I actually have meals that are left over from dinners or lunch. It feels great that I can live on my own and have my freedom.
Whether we have a disability or not, very well-intentioned supporters can sometimes make decisions about our life or try to really influence decisions about our life.
It's your life. When I make a tough decision, it would be something that might be hard and a challenge, but I'm up to the challenge. But like I said, you have a group behind you. The reason why you have that support group is because they know what you want and they'll like to help support you. If you need help making decisions, go to your full support team and they will have your back.
So this is such a big topic that I like to refer people to Classy, Disability Rights Delaware, for like a really robust conversation, and also they can help you sort of sort out your options. And they can be really good partners in helping you sort out like what's right for you and help you like figure out what your choices might be in this regard, because it can be pretty complicated. So I wanted to include some helpful resources on decision making, and also the Delaware Autism network, DNEA, can be really helpful and has tons of resources on supported decision making. The Delaware Network for Excellence in Autism is just such a great resource that we have. They're also going to be at our September gathering. So I wanted to include their resources as well. They also have a really nice handout on explaining supported decision making to community members. So, like, let's say you do a supported decision making agreement and you are like at the bank or something, and they're like, I don't know what supported decision making is. You could literally hand them this handout that explains in the perspective of community members what supported decision making is. So you can educate them on it without having to like do a big spiel like, okay, well, here's a handout about what it is. This is a legal alternative that I'm using. So that can be really helpful as well. So DNEA has tons of supported decision making resources as well. People come to clinic wanting a lot of information about Medicaid, Medicare, private insurance. It's a huge topic. One of the nice things about SSI in Delaware and many other states is that even if you only get a couple dollars of SSI, you automatically get Medicaid. And there's also special programs for workers too. So that can take a lot of the stress, especially right now when Medicaid is so at risk. It can take a lot of the stress out of whether you're going to lose Medicaid or not. So SSI is a big topic in our clinic as well. A lot of times, people are applying for the first time at 18 because they didn't qualify due to family income in the past, or they're getting redetermined at 18. They're getting looked at with new eyes. So a lot of times that is a big topic that we talk about in clinic as well. And then people are like wondering like, oh, what's SSI? What's SSDI? There's so many different acronyms and alphabet soups. And people are like, what's Medicaid? What's Medicare? We're also trying to like, a lot of times young adults are like, what is all this stuff? There's a really good resource called Triage Health, which is a website, triagehealth.org. I think I put it on here. That just explains like all the stuff for people with chronic health conditions and has like videos and one-pagers. And it's just like an invaluable resource for explaining all this stuff so clearly and concisely in simple language. Because this stuff gets confusing. Like, no wonder people are confused. It's super confusing. It's a lot. And then also a lot of parents who have private insurance through their own job can, if they want to, sometimes keep it for an adult child with a disability. So past 26. So you can always ask your HR about that. So this is another big topic in clinic, is what I'm trying to say. I already touched on this a little bit, but SSI and SSDI is something that people are like a bit mystified about. It's also something that sometimes people struggle with legally because sometimes like they had gotten it in the past and then owed maybe overpayments, so they don't know if they can get it in the future, especially once, the young adult turns 18. And I always direct people to Classy, to Disability Rights Delaware, to sort of talk to them about that because sometimes they can help with like figuring that kind of stuff out. Because you definitely don't want to just forget about it or ignore it because it's sort of uncomfortable. That's something where if you feel like your young adult has a disability that's going to get in the way of them working as an adult, you definitely want to apply for it. So at the age of 18, people are looked at under a new lens as, is a disability going to get in the way of them working to a certain level? And that's how they look at them if they're going to qualify for SSI. So they don't look at family income anymore. 18 is the age, 18 and a month is the age where you can sort of apply for SSI and sort of get a new like evaluation. So that's the age where people are like, okay, I know I'm supposed to apply. I'm not sure why. But that's the age where they don't look at the family's income anymore. So if you made too much money in the past, you can help your young adult apply. But they're also looking at them as a worker, and if their disability or special health care need is going to get in the way of them working to a certain level. So it's not to say they can't work at all, but it's to say, is is their disability or special health care need going to get in the way of them working, like basically like working full time? So this is a big topic in clinic. We give some tips, we talk about it, we talk it through, we give resources. And again, if you're getting SSI, you're going to get Medicaid automatically without having to jump through a bunch of hoops and potentially like losing it. Like the way that things are going to be, you know, in the future, it's sort of going to be maybe a little bit more difficult to keep Medicaid. So SSI is going to make it less stressful if you have it. And then something I'm always telling young adults, we get a lot of young adults with special healthcare needs who maybe come in without their parents or maybe like don't need as much parental support. And I always tell them like, oh, if you lose your insurance, like what if you lose your Medicaid? Because that's going to be a reality here in the future, probably. I always tell people like tell your doctor because there might be a program that you can get connected with. Like there might be a health navigator, especially if you're a Christiana Care, who can connect you with a like maybe a program or a social worker who could get you on a program. There's a lot of stuff out there that people don't know about that can help you with your health costs. So always tell your doctor. Or you can visit your state service center to see if you might qualify for Medicaid. Or you can go to the the Assist website. Or you can go to a federally qualified health center and see if you can get on a sliding scale. And then, I give them the link. So the last thing I don't want people to do is not get health care because they don't have insurance. So that's something we talk about in clinic as well. And then we always talk about Delaware 211. I didn't put it on here, but we always talk about Delaware 211 as well. And 211 in any state. And then we're always talking about assistive technology and, trying to make the most of independence by using assistive technology. And nowadays, people are getting more comfortable with, using smart home technology, using their phones and all that kind of stuff. So it's not as foreign as it once was, but still, even so, I feel like most people don't really know when I mention it about Daddy and Easter Seals resource room. So we like to talk about that and kind of, give them some examples about how assistive technology can be helpful. And every state has its own version of Daddy and its own assistive technology resources. That's state specific. And then these are our tips that we give every patient. It's in their like patient instructions, and I just copied them here for you all. Again, just some things about not waiting till last minute because of wait times, and we never want there to be a gap. We'd much rather there be an overlap. Just because you see an adult doctor doesn't mean you're going to get the boot from Nemours. Like you can have some overlap. That's okay. We'd much rather have that. And I just want to offer myself as a resource. So if you feel like anything I said today felt relevant, but you want to dig a little more into it based on your personal situation, you can call me. This is my personal number. This is my work number. So if you want to call me and be like, hey, you said something about this, but I don't know if this applies to me. Like, can we talk about it? Just give me a call. I'm a community member. I'm always happy to talk. I feel like I'm a PIC member. Like I'm always happy to help. Nobody has to feel like left behind or unseen if I have anything to do with it. So feel free to reach out. I'm always happy to chat. So I wanted to leave a little bit of time for questions. And I feel like the timing worked out pretty well. So I'm going to stop sharing. But I did also, oops, I don't know how I just did that. I did also include some other resources for you all. So if you want access to this PowerPoint, I will send it to Mary and you can all have all my resources. These are all for sharing.
Thank you so much, Lauren. It's always a pleasure working with you. I did have a question, and I'm not sure if you have the answer to this, but this has come up in a couple of our cases where pharmacies are now turning over the responsibility to the student at like 13 now, and denying parents access to complete refills and things like that. Are you familiar with any of that? I mean, that's a new thing for us too. So we were just trying to navigate that.
I haven't really heard that, but you know what? I will circle over to Classy and see what they advise, and I'll get back to you.
Okay, okay. Yeah, I know it was a big thing like in other states, but we have heard a couple times of that. I don't have the information specifically, like if it's certain pharmacies, but I just wasn't sure if you had any information.
Yeah, that's a good question because privacy rules do change around the teen years.
Mhm.
But I haven't heard anything like, of course we're always asking questions about,
Yeah,
what are people experiencing, but I haven't heard anybody say anything. So I will definitely I'll ask Classy like what they're usually my go-to for stuff like that. So
yeah. Okay, okay. Well,
does
thank you
anyone
so
else
much.
have anything that they want to ask or anything on their minds?
I do, Lauren. How are you? Jennifer Aaron here.
Hi.
I wanted to know because we have another almost similar to Mary's, but it's a little bit different. We have a lot of families that don't have all the information for transition until the last minute.
Mhm.
And so at 18, is there a gap? Is there a grace period if a parent has not signed any form that HIPAA form or form that they can still help their young adults for prescriptions or talk for a nonverbal child with autism, for example, and they have not done the work or going to Classy for the decision making. Is there a grace period, like once they go see the doctor, or like to the pharmacies to say, hey, we're in the process? Is there is there also a process to expedite getting that documentation to the appropriate agencies or parties, because they haven't done the homework? Does that make sense? Okay.
Yeah, no, and that's like
Okay.
so, I mean, that happens. Like people turn 18 and it's like, oh gosh, now what? And then there's like a
Mhm.
rude awakening because nobody will talk to them.
Right.
So I think the best thing is just to know that there is also a health surrogacy law in Delaware. Is that something that you're familiar with?
I am not.
Okay. So that's something that if an adult can't speak for themselves, like they lack the capacity. Now, being non-speaking doesn't mean you lack capacity necessarily.
Correct.
But, if they're not able to speak for themselves and their doctor agrees with that, their parent is able to speak for them if they don't have a guardian and they don't have a healthcare power of attorney. So that is something that you can look. I mean, I can send you if you want to put your email in there, I can send you the law.
Thank you.
And I can send you, Classy did do a little like worksheet on that too. So people can be armed with the knowledge that they can speak for their young adult if they can't speak for themselves, or they can go ahead and do a healthcare power of attorney. I mean, if someone has the capacity to say, like, I want my mom to, speak for me if I can't speak for myself, they can do supported decision making and do all that stuff and have it in place. Or they could do a HIPAA form on the fly. I mean, they can do it if they can designate their mom to speak for them. They don't have to be speaking if they can sign a form and indicate that.
So that could be done like, at the doctor's office
Yeah.
or right. Okay. Because I didn't know if it can be done. I know it could be done, but I'm thinking how long does it take? And I think that so it doesn't hold up any prescriptions or doctor visits that need to be done like immediately. So thank
Let
you.
me have a look at that, Midra. Um, it's 2507. 2507. Hold on, I'll put it in there. Yep,
That's
very
really
good.
good information about the health surrogacy. I don't think I've
Um,
ever.
But just for awareness, anybody who has DDDS right now, there is a grant with Disability Rights Delaware where Hope can help you navigate all that stuff, and it's
Mm,
free. So
Okay.
Thank you.
yeah,
And for those of you that don't know, Hope will be joining us at the symposium to share a little bit more about the information that Lauren shared through her presentation. So you can get more information there. I did put the link in the chat if you have not registered yet for the symposium, so you can see us again. If there are no more questions, we will let you get back to your day. Again, Lauren, thank you so much, and I'll be seeing you soon.
absolutely. I will send you the PowerPoint so you can send it out to everybody.
Okay, will do. All
All
right, have
right.
a
Oh,
good one,
always a
guys.
pleasure.
Thank
Thank
you.
you. Same, same. Thanks, Lauren.
My pleasure. Take care.